Hello, 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 hello. Today is World Cancer Day, and I will be focusing on oral cancer screening. Do it yourself by the misfortune. The learning outcomes are understanding risk factors associated with oral cancer, recognize the clinical signs and symptoms of oral cancer, and perform your own screening examination. Do it yourself. This poster shows you how you can save your life by doing this 2 minutes test. So I want you to wash your hands, stand in front of the mirror, and do the following test. Look at your face, look for any lumps, inspect your skin, look out for symmetry. If you look at half side of your face, does it look the same as the other side? Look at your neck. Stretch your neck. Feel if there are any unusual lumps on your neck. Look at your lips. Feel the lips. Do you see any discoloration or any ulceration on your lips? Open your mouth. Lift the lips, upper lip and lower lip, and look at your gums. Use your tongue to feel the gums. Are they soft or squishy or are they firm? Look at your tongue. Say ah. Protrude your tongue. See if there are any ulcerations on the lateral border of the tongue, on the floor of the tongue. Look at the roof of your mouth, which is the palate, and check if there is anything unusual. Look at the cheeks as well and see if there's anything unusual. And look at the floor of the mouth. This is now statistics. According to cancerresearchuk.org, this information was taken on the 23rd October 2024. It says that the proportion of all cancers, head and neck, 2000 to 2019 in UK forms about 3% of all cancers. And it's normally common in the age between 65 to 69 years of old. And the trends so far is that oral cancer is on the increase. So what do we do about it? In this webinar, I will be covering ground rules about me, what I have done, oral screening and tips, questions and answers. Since this is a webinar that is being recorded, you can write your comments or ask your questions in the comment section and chat in the comment section. Here's what I've done in the past. I've written a book on positive work-life balance. Do you know the difference between positive work-life balance and negative work-life balance? The negative work-life balance leads to burnout, and you can prevent it by following your passion. The second book I wrote was Mommy, What is Tooth Decay? Since I'm very passionate about prevention is better than cure, hence this webinar on World Oral Cancer Day to be able to encourage you to do it yourself, to do oral screening. Always remember, in order to be diagnosed as having oral cancer, you need to be seen by a specialist to carry out an assessment, social history, medical history, or your medication, blood test, biopsy before. So this is a disclaimer. This is not to alarm you, but to empower you and encourage you to be able to look out for the signs and symptoms and seek medical help. Third book I wrote was Book of Poetry, why I create. I love poetry. Hence, I write poems. I love acrostic poems and free verse. So, one may ask, what is oral cancer? Oral cancer is a malignant neoplasm or cancerous tumor A tumor can be benign or cancerous. Benign means it hasn't spread. The malignant means it spread to the other parts of the body. Oral cancer kills as many people as melanoma and is now more common than leukemia. Hence, it's very important to look out for the signs and symptoms. So one may ask, what are the risk factors? So for example, when a patient visits the dentist, we always ask for medical history, social history. Do you drink? Do you smoke? So if you smoke and if you drink, your oral cancer risk is high. Always bear that in mind. And these are some of the risk factors. That is why it's important to practice dental prevention is better than cure. We try to tell people when you smoke, it affects your gums, it makes your gums bleed more, and advise people to stop if possible. So, signs and symptoms. So, if you have got an ulcer in your mouth, which does not clear up in 2 weeks, because there are times you may feel run down and you may have an ulcer, and that clears up by itself. But if you have an persistent ulcer, which has got a red patch or a white patch, or the ulcer is not clearing up after 2 weeks, please seek medical attention as soon as possible. So, what are the signs and symptoms? An ulcer which is not healing for more than 2 weeks, a white patch, or a red patch. Some white patch, when you use your finger, it rubs off. That is the candida. But the other one does not rub off. And there are times it's associated with other medical conditions. So it's very important to look out for it. There are certain things you can go to this following links and it will give you more insight. For example, the first link tells you what an oral carcinoma is. The second link will tell you what is leukoplakia, and the third link will tell you how to examine yourself. All those are very important because a picture is worth 1,000 words. So if you look at the picture and you look at the video, that can help you identify. Oral cancer screening DIY, which we've already done at the very beginning of this webinar. It's very important to have this oral screening DIY that you can always refer to. You need to know what is normal and what is abnormal because you live with yourself 24 hours and you will be able to tell if there's something that is not right or that is very different. Austria, if you look at this patient, you can see there's something wrong here. If you look at her lower jaw, you can see it's a little bit swollen. So that is something that is abnormal. And with this, it's very difficult to tell because it could be hereditary, it could be an infection, it could be a tumor, it could be genetics, it could be anything. So just looking at it, you know there's an issue. And such a person needs further examination, medical history, social history. You need to take a very good history. You need to carry out certain tests to be able to arrive at diagnosis and be able to treat this patient accordingly. This picture tells you something is not right, but we don't know what it is. It could be a tooth infection, it could be an edema, it could be anything. Intraoral examination is very important to be conversant with what is normal. So if you look at this sagittal section of the head and neck, it shows you certain things that you need to know. It shows you the teeth, the tongue, the neck. So these are the norms. So if you find anything that's abnormal, then you know that something is not right. If you have bleeding in your mouth, that is not due to gum, loose teeth, or your voice is your voice has changed all of a sudden. These are signs there could be an underlying problem. Or you have white patches, red patches, you need to seek medical attention. So, for example, there are different types of ulcers here, going through the different grades. So you can have a look at the picture and see what it is: erythema, ulcer, soreness, So looking at the lateral border of the tongue, the lower lip, anything that is unusual, please seek medical attention. Remember, today is World Cancer Day, and this webinar is about empowering, educating you to be able to do your own self-examination. Some of the screening tools, at times they use a dye to be able to look out for cancer cells or a biopsy. Oral cancer examination, oral cancer prevention, I've already spoken about the DIY examination. So it's a lifestyle choice. So there are different ways to reduce cancer risks. For example, as you can see on the screen, these are some of the things that you could do to help yourself. Always remember, prevention is better than cure. This is a lung of someone who I'm sure has got nicotine or something like that. So this is what happens. I think of late, when people go buy six or something like that, they've got pictures on the packages to help people find out what are some of the signs and the symptoms. So it's good to know what is normal and what is abnormal. If you know what is normal, if you find anything abnormal, you're able to deal with it. That is why it's very important on this World Cancer Day to be able to empower and educate. Do it yourself. As a disclaimer, you cannot say someone has got cancer just like that. You need to carry out other tests. If there's anything, this is a disclaimer. If there's anything in this webinar that you feel can help you, please seek medical attention to be examined and tests to be carried out. Do not be worried. This is just to help you and educate, empower you. And practice prevention is better than cure. The tips I would like to share with you is regular visit to the dentist, change your lifestyle, and try and practice self-examination. If there are any questions and answers, please put it in the comments. Thank you for coming. Thank you. Very grateful. Please share the knowledge. Thank you for staying on. See you in the next video.